Hello and welcome everyone to this webinar on the 2021 Illinois Kids Count Report, which focuses on childhood poverty and Illinois housing issues. I am Mitch Lifson with the YWCA Metropolitan Chicago. Today's event is co-hosted by Voices for Illinois Children, powered by the YWCA Metropolitan Chicago, Housing Action Illinois, and the Illinois chapter of the American Academy of Pediatrics. Joining me today in this presentation are Bob Palmer, Policy Director at Housing Action Illinois, Sheila Sutton, Housing Policy Organizer at Housing Action Illinois, Mary Elsner, the Director of Health Equity Initiatives at the Illinois chapter of the American Academy of Pediatrics, and Dr. Nancy Heil, a pediatrician, also a volunteer with the Illinois chapter of the American Academy of Pediatrics. You can use the Q&A function in Zoom to present us with any questions you have as we go along, which we will get to following the presentations. If you have any problems today with the Q&A function, please place a message in the chat box, which we will also be monitoring. Also with us today is the Vice President of Policy Research and Evaluation at the YWCA Metropolitan Chicago, Dr. Caitlin Jones, and Danielle Stanley, Policy Coordinator at the YWCA Metropolitan Chicago. Today, we'll take a look at the highlights from the Kids Count report, look at the impact of housing instability on Illinois children, and also discuss related housing issues, including affordability. So with that, we shall get started. Voices for Illinois Children leads the Illinois Kids Count project as part of a national and state effort funded by the Annie E. Casey Foundation to track the status of children and families in the United States. Since 1992, we have worked to provide policymakers and citizens with benchmarks for child well-being in Illinois. Typically, that involves an examination of Illinois children's health, education, family and community circumstances, and the topic of today's webinar, economic well-being. We'll work to break out the available data by race, ethnicity, and geography, take a look at where the needs exist and where the disparities also exist with regards to child well-being. Pre-pandemic, childhood poverty was decreasing from close to 22% in 2011 to just over 16% in 2018. Yet keep in mind that at 16%, that still represented 436,000 children. For reference, the 2018 federal poverty guideline was $16,460 for a two-person household and $25,100 for a four-person household. We'll touch on this in a few minutes, but with increased unemployment due to the pandemic, even with the economic recovery shown during the first part of this year, and with the COVID relief payments to households in 2020 and 2021, the number of children in poverty will likely show an increase when the 2020 census data is released later this year. If we dig into the data, we see that African American children experience poverty at a far higher rate than Latinx children and white children. While our time is limited today, I'll note that this is why we disaggregate the data, and in our report, we take a further look at household income by race and ethnicity, as well as a demographic breakout of employment sectors. And as noted, we take a look at the geography of poverty in Illinois. Now, this particular map shows the data by county. We recognize that within each county, the depiction by the percentage of children in poverty may mask what are high pockets of poverty in certain regions of a county. So we also have a table here that shows the highest percentages as well as the actual number of children in poverty by county. It's important in the policymaking realm to use both pieces of information, because part of the question is what resources or employment opportunities are available to Illinois parents. In raw numbers, Alexander County may have fewer children at 100% of the federal poverty level. It was 1,552 children in 2018, but there also may be far fewer resources available to them and their parents as opposed to a more populous county to get out of poverty in both the short and the long term. And while 100% of the federal poverty level is typically a benchmark used for poverty, the truth of the matter is that it takes about double that amount for most households to meet their basic needs. More than half of Latinx children and nearly 2/3 of African American children are at or below 200% of the federal poverty level. If we regularly looked at and discussed child well-being in this state through this lens, our contention is that we'd be having a much different discussion at all levels of government on how our children are faring and how we allocate public resources, which brings to light the question that is the basis of the Kids Count report. How do we measure child poverty? Two researchers at the University of Oxford designed a multidimensional poverty index. In short, it involves looking at those major items impacting poverty, the population at large impacted by those factors, and how many are impacted by more than one factor. The premise is that it is not just income, but a range of other factors that influence and are influenced by poverty. And by isolating the more prevalent factors, it helps lead us to policy solutions that may have the greatest impact. Here are the factors Voices examined. As you can see, this is a list that includes employment status, housing costs, education, English fluency, and health insurance. Of the state's population, more than 15% were in multidimensional poverty, that is impacted by more than one factor in 2018. Of that 15% in multidimensional poverty, adults were deprived of approximately 2.5 factors. Again, you can see the average here in terms of deprivation of factors. What factors were most prevalent? Well, first was income, but a close second was a high housing cost burden, followed by a lack of a high school diploma. We also looked at the factors by race and ethnicity. So when you do so, you begin to see differences in terms of the impact of each indicator. For African American households, the two most prevalent factors were income and housing costs. For Latinx households, the two most prevalent factors were lack of a high school diploma and no health insurance. Now, that's not to say Latinx households don't face issues related to housing costs, but of all the factors listed, a greater percentage are impacted by the issues of having a high school diploma and health insurance. When we factor in household makeup, Voices estimates that 1/4 of Illinois children live with at least one adult who is in multidimensional poverty. That equated to approximately 735,000 children in 2018. With nearly half of Latinx children in that situation and almost 40% of African American children in that situation. All of this is to point out that whether by using a multidimensional index or 200% of the federal poverty level, there are more children in need based on overall economic circumstances of the household than would be reflected by 100% of the federal poverty level. And by using the multidimensional index, we can see the large role affordable housing plays in meeting the needs of Illinois children. Now, because of the data available when we began this report, much of it is pre-pandemic. But we do know that a significant percentage of each demographic group within the state was spending more than 30% of their income on housing. And the issue was most prevalent among African American households. We also know that during the pandemic, based on electronic surveys conducted by the US Census Bureau, that overall more than half of Illinois residents with children in their home and nearly 2/3 of African Americans in households with children lost employment income between March of 2020 and March of this year, and that as of May of this year, nearly half of African Americans with children in the household affirmatively responded to the survey that they had little or no confidence in their ability to make the next rent or mortgage payment. Now, others will be talking about some of the available rental and mortgage assistance in a moment, but here are the recommendations contained in the Kids Count report to improve the economic conditions of Illinois children and their families. In the interest of time, I'll be brief, and I encourage you to go to our website and download the report. The recommendations include indexing the state's minimum wage to the inflation rate, expanding the eligibility of the state's earned income tax credit, making permanent the increase in the federal child tax credit, an extremely important measure, but one enacted by Congress for only 1 year. By itself, it's estimated that the increase in the federal child tax credit will cut child poverty in this country by at least 40%. Some of our recommendations regarding housing: expanding the availability of affordable housing, and also establishing a state's renter tax credit. We have in this state a property tax credit, but not a similar credit for renters. Establishing funding for early childhood education and enhancing the state's monetary award program to make college more affordable to the state's residents. So that is an overview of the Kids Count report. Again, you can go to our website, noted here at www.voicesforkids.org, and download a full copy of the report. And at this point, I'm going to turn it over to Dr. Nancy Heil, who will be talking to us about the impact of housing instability on children.
Good afternoon. Thank you for the privilege of speaking at today's panel. I am a general pediatrician who retired in 2018 after 37 years in clinical practice. I've been a volunteer with the Illinois chapter, American Academy of Pediatrics, since 2019, working on the First Steps Improving Child Health and Housing Initiative and the Collaborative on Child Homelessness Illinois. This work, which is the brainchild of Mary Elsner, ICAP Director of Health Equity Initiatives, has included many other physicians and the staff of housing and early childhood organizations, some of whom are here today. Homelessness needs to be understood as including both the literally homeless and people who live doubled up in overcrowded conditions with relatives and friends. Looking at these two populations combined, 59% of people experiencing homelessness are children under 18 years of age. The majority are Black or other people of color. Historical and structural racism plus economic disparities have created this situation. Profound short and long-term health risks appear to be greatest for the very youngest children and grow worse with the duration of homelessness. The risks begin before birth. Homeless pregnant individuals are more likely to suffer pregnancy complications than their housed counterparts. This is true even when studies control for socioeconomic status. Next slide. Bleeding and premature labor are the most common complications suffered by the homeless during pregnancy. When homeless parents give birth, their infants are more likely to be underweight, to be premature, to need a special care nursery, and to require assisted breathing with a ventilator. A 2020 study looking at how expenditures by state and local governments reduced infant mortality found that, compared to several categories of spending, increasing the budget for housing and improving other environmental factors decreased deaths in newborn infants more than any other type of government investment. This month, a very limited study came out of Columbus, Ohio. Healthy Beginnings at Home tested the impact of providing rental assistance with support services to unstably housed pregnant women. In the group of 51 women who received rental assistance and extra support, there were no fetal deaths, and 78% of the infants were born full term at a healthy weight. In comparison, among the control group of 48 women who did not receive rental assistance, there were 4 fetal deaths, and the remaining 44 women who eventually delivered live-born babies, only 55% of their infants were born at a healthy weight. The study was too small to be considered statistically significant, but the findings are consistent with the earlier 2020 study on government spending and infant mortality. The reason that infants and children younger than 7 years old are especially vulnerable to the ill effects of homelessness is because their brains are rapidly developing and changing. Their stress response pathways are also forming. Early extreme stress, which occurs when a baby is still in the womb or in the first few years of life, can rewire the brain and other responses in the body in ways that affect physical health, emotional responses, and learning. Next slide. Physical health problems are known to be linked to childhood homelessness include asthma, skin and ear infections, obesity, and dental disease. These children also have higher rates of accidental injuries and, not surprisingly, intentional injuries. When the body's stress response is significantly altered, behavior and attention problems may result. Infants and preschoolers also risk having developmental delays, especially speech delays. They may not be ready to start kindergarten at the right age. Once they are in school, they are more likely to suffer academic failures. A history of homelessness exacerbates what are known as the adverse childhood experiences, or ACEs. Next slide. When children with a significant number of ACEs reach adulthood, they are more likely to suffer from lung disease, strokes, heart disease, diabetes, and mental health problems like depression and anxiety. This terrible human toll should be our greatest concern. There is an additional heavy financial cost to our society as we pay for the treatment of these problems and lost productivity. Preventing families from becoming homeless is the most effective strategy we have for protecting children. Once families become homeless, we should ensure that they are quickly rehoused and receive the supports that will allow them to successfully keep their housing. Stable housing for children is a component of optimal development and health. Parents who worry about where their families are going to sleep each night have difficulty providing the security, nurture, and responsiveness that their children need to thrive. We all want to see every child reach their full potential, and it is our responsibility to ensure that this happens. Thank you.
Hi, my name is Mary Elsner, and I'm from the Illinois chapter, American Academy of Pediatrics. Thank you, Dr. Heil, for talking about the basis of our focus on birth to 6 and individuals who are pregnant. We wanted to let you know about a few opportunities where you could get involved and receive free training. We, ICAP, have, through our First Steps Improving Child Health and Housing project, have been working across the healthcare and housing systems to provide training. And you can find this training on our website, Child Health Risks, Navigation of the Healthcare System, which targets shelter staff and housing case managers and others who are interested, and a primary care primer on housing insecurity in children for physicians or other healthcare providers. We also launched in 2020, June 2020, the Collaborative on Child Homelessness. Next slide, please. And many groups, about 55 organizations, have come together to work on strengthening the voice for young children and pregnant individuals. The collaborative first, as Nancy has said, is to prevent, our goal is to prevent and end child homelessness and housing instability. We have been commenting on proposal to increase housing capacity for this age group. And we have also been fostering collaboration to improve system coordination and integration among these different sectors. If you would like to join us in this effort, we would love to have you. Please contact me. My contact information is below. This is a coalition that's trying to reimagine the housing system as well as to prevent child housing insecurity.
Thank you. And now we will turn it over to Bob Palmer with Housing Action Illinois.
Thanks. I believe actually my colleague Sheila is going to go first.
All right.
Hi, my name is Sheila Sutton, and I am Housing Policy Organizer at Housing Action Illinois. My colleague Bob Palmer is a Policy Director at Housing Action Illinois. For those who are not familiar with Housing Action, we are a statewide coalition working to protect and expand the availability of quality, affordable housing throughout Illinois. All the work we do is in coalition, and we are a coalition of approximately 160 member organizations. We first, you can go to the next slide. So first, we just wanted to give you a snapshot of the recent report released through the National Low Income Housing Coalition, which is called Out of Reach. And to note that to rent in the state of Illinois, on average, a person would need to make $22.11 per hour in order to have their housing costs be no more than 30% of their income. What that means is that for many households in the state of Illinois, in order to afford a 2-bedroom apartment, at the rate of the current rent on average, which is about, for fair market rental rates, that rent for a 2-bedroom apartment is $1,150. And a family would have to, the wage earner would have to be working at minimum wage 80 hours per week to afford that 2-bedroom apartment in the state of Illinois. A 1-bedroom apartment is $972 on average in the state of Illinois. And for households that may rely on Social Security income, that is also very much out of reach for households. Some of the most expensive counties are in the Chicago, Joliet, Naperville area, Kendall County, Grundy County, DeKalb, and Kankakee. The average renter wage currently that you would need to afford in most places is $18.23, but the minimum wage in the state is $11 an hour. So these are some things to think about as we're wondering how families, particularly those with children, are able to access housing in the state and what it means for housing, what it means to have affordable housing. The report that Mitch went through, as well as Nancy's information previously, really talks about what it means, the importance of housing stability, but we see that it's very much out of reach for a lot of families in the state. Next slide, please. So with the COVID-19 federal housing funding for Illinois, there was the federal legislation that has become law, and the state of Illinois and local governments are receiving approximately $3 billion for affordable housing and homelessness needs, as well as another 2,100 emergency housing vouchers. So that is in response to this crisis, but it doesn't engage the issue that was happening prior to the COVID-19 pandemic. So in order to really fully engage and create housing and affordable housing throughout the state, we have 4 policy recommendations at the federal level that we're hoping to see. The first one is bridge the gap between incomes and housing costs by expanding rental assistance to every eligible household. At this time, only out of every 4 folks who are households that are eligible for housing assistance, only 1 household actually can access that because of a lack of rental assistance. We want to see an expansion and preservation of the supply of affordable rental homes for people with the lowest incomes, and stabilization by providing emergency rental assistance to households in crisis through creating a permanent structure so that we're not behind the 8 ball whenever there's a crisis. We also would like to see strengthening of renter protections and more enforcement of renter protections. We have a link on this slide that people can access to email your federal legislators so that they know about the policies that will help to alleviate these issues, and we appreciate if you take action and click on that link when these slides go out. Next slide, please. So at the federal level, there are currently efforts in place, which is why we really want you to contact your legislators, to fund housing. The American Jobs Plan was President Biden's original proposal, and it had $2.3 trillion for infrastructure, with $318 billion to create affordable housing and end homelessness. Right now, the Senate Democrats are working on a reconciliation process package, which we don't have all the details for. It's $3.5 trillion, which includes $45 billion from the National Housing Trust Fund to deal with some of the backlog and repairs for public housing and expansion of rental assistance for those with the lowest incomes. Currently, we do need people to contact their federal legislators to encourage them to remember that there are a lot of competing pieces during this reconciliation process, and housing is one of the most important ones. There are two bills that Maxine Waters has introduced. One is the Housing as Infrastructure Act, and the other is the Ending Homelessness Act. Both of these bills seek to create the funding to enhance and create funding mechanisms to increase rental assistance, repair public housing, create more affordable housing. And I'm not going to go into any more details for this part, but if you have questions, feel free to contact us or go to Housing Action's website, and we'll put that in the chat. Bob, I'm going to turn it over to you.
Thanks, and we can go to the next slide. So I'm going to get into what's happening with the eviction moratorium and what resources are available in a moment. But before that, I'm just going to talk a bit about what happened in the recently completed Illinois General Assembly session and some things that we didn't complete that we're still working on. I'll just say that in the General Assembly this year, there was a great deal of interest in housing issues, as I think the whole reason why we're having this webinar and connecting housing to other issues like early childhood welfare, early childhood education, is that I think the pandemic has refocused attention on affordable housing as it impacts everyone, including young children and families, as an important human rights issue and basic human need. We were all encouraged to stay at home as much as possible early in the pandemic. Obviously, for people who struggle to afford a safe, decent place to live, or especially if you're homeless, if you're couch surfing or in a homeless shelter, or worst case scenario, literally out on the street or in an unsafe relationship, it was very hard, if not impossible, to kind of follow that public directive to keep yourself and keep everyone else safe. And then obviously too, we have the eviction moratorium, which has been in the news a lot, which is now coming into an end in Illinois and around the nation. So I think because of all that, both at the federal level and at the state level and at the local level among elected officials and the media and so forth, there's been a lot of interest in housing issues. So in the General Assembly session, we did have some good victories. A bill that we're actually expecting Governor Pritzker to sign very soon is HB 2621. That is an omnibus bill. It has lots of different components, but in short, it creates new resources to create and preserve affordable rental housing, both through direct state funding using federal that were federal fiscal recovery dollars, and then also creating some new property tax incentives for the creation of affordable rental housing. Also, it strengthens an existing state law, the Affordable Housing Planning and Appeals Act, that encourages and requires local governments that don't have much affordable housing to do more planning to create that housing. Then actually earlier in the session, it passed earlier in the session, was signed into law by Governor Pritzker in May, was the COVID-19 Emergency Housing Act, that set important rules and guidelines for the federal rent assistance that the state of Illinois is distributing right now. But importantly, knowing at some point that the eviction moratorium was going to come to an end, between the beginning of the moratorium in March 2020 and in March 2022, it seals all eviction records with some limited requirements for unsealing, so that filing an eviction case against someone doesn't become an obstacle to them in the future to find a landlord who's willing to rent to them. And basically, if it's just a non-payment cases, which is the vast majority of cases, all those records will stay sealed. There are opportunities if the landlord is maintaining there was some other sort of lease violation particularly if it relates to a health or safety issue, for those cases to be unsealed. So we think that's a very important protection. The bill also restricts tenant screening companies, again, through March 2022, from reporting on sealed eviction cases. Then finally, in the state budget this year, the General Assembly committed significant resources that Governor Pritzker signed into law when he approved the budget for affordable rental housing, including $75 million to provide additional financing to projects that are having development gaps if they got federal low-income housing tax credits. There's more money for supportive housing, which is housing in with services that particularly targets people who have a history of homelessness or issues like mental illness or substance use disorder, and that build on the other dollars that were directly available for rent and mortgage assistance from the state of Illinois. And then go to the next slide. There were a couple bills that didn't pass. One would create a new state housing tax credit for affordable housing to complement the low-income housing tax credit. That would give more resources for developers to build affordable rental housing. And then there's the bill that Senator Hunter and Representative Ramirez introduced. And then there is a bill, House Bill 3878, that we were working on with Curtis Tarver and other members of the General Assembly that would increase resources for a state rental assistance program called the Rental Housing Support Program by increasing the fee that funds that program. Then going on to the next slide. So I think people are probably aware that the federal eviction moratorium is coming to an end at the end of July. Several weeks ago, Governor Pritzker announced that he was phasing out the state of Illinois eviction moratorium by the end of August. So he's released press releases and executive orders to inform people about that and kind of set the rules for going forward. So as of August 1, eviction filings will be allowed in court against people, even if you're a covered person, meaning that you lost income during the pandemic and you've kind of documented that for your landlord, but there still is a prohibition on law enforcement carrying out eviction orders and forcibly removing people from their home if you are a covered person and you've let your landlord know by filling out the proper form that you've lost income, you've been trying to pay rent and meeting the other requirements of making you a covered person. So that provides some breathing room to make use of a very important order that the Supreme Court issued and also goes into effect August 1, basically saying, again, if it's a case against a covered person, again, it's generally these non-payment cases, which are the vast majority of eviction cases, that those cases will be temporarily stayed during August, and that if the landlord or tenant has not already applied for rent assistance, and there's many people who have those applications pending, then those cases will be referred to rent assistance and other types of services to try and avoid the eviction, such as case management or court-based mediation for those counties that have that. And this is partnership of the court system, providers for the Illinois Department of Human Services, welcoming centers that are focused on serving the immigrant constituency in Illinois, legal service providers from the nonprofit community, and others working together to prevent as many evictions as possible during the coming weeks and month. In the slide, there's a link to the court order there, and there's also a link that the declaration of the tenant needs to fill out to attest they're a covered person. And then the final slide is just links for some emergency housing assistance. The first two are the most important. So even though some web portals are closed to apply for rental assistance, there is still rent assistance available through the Illinois Department of Human Services provider network. So go to illinoisrentalassistance.org to get connected to an assistance provider. For people who need legal assistance, they can go to evictionhelpillinois.org to get connected to a legal assistance or provider in all parts of the state. On the Housing Action Illinois website, we have more information about the rent assistance that's available. And then also there may be people on the webinar who are interested in mortgage assistance. So the Illinois Housing Development Authority is going to be launching a mortgage assistance program later this fall. So, and Mitch has put the questions slide up, which I guess means it's time for questions.
Thank you. Yes. So again, please feel free to use the Q&A function or the chat box. I don't see any questions at the moment, so I will start with a question. With regards to Illinois rental assistance, is there a deadline for when you can apply?
There's not currently a deadline. If you go through a Department of Human Services provider, you can also contact the Welcoming Center. In all parts of the state, that illinoisrentalassistance.org has organizations you can contact. Some of the other rent assistance programs like that, the Illinois Housing Development Authority was operating, or the city of Chicago or Cook County were time limited, and those programs are closed, although some of them are open in other counties. So I go to that link at the Housing Action website to find out the status of those programs. And then also IDA, the Illinois Housing Development Authority, the city of Chicago and Cook County will be opening up their programs again for new rounds of rental assistance, we believe in September.
And is there a limit on how much assistance you can get?
It varies by the program. I believe for the IDA program, for the round that they just closed, the maximum amount was $25,000, but I believe they've determined that most people don't need that much. I'm not sure what the limits will be at that point. It really varies by, for their next round, it really varies by the program.
All right, thank you. We have one question here. It says, Dr. Heil spoke about the increased risks that children and pregnant women face when experiencing homelessness. Could you speak more about the risks that those at risk of homelessness face, and how might we identify those who are at risk of homelessness and advocate for them to get resources they need?
Okay, the second one sounds really hard. With the first part, again, for women who are pregnant and housing insecure or homeless, their biggest risks are premature labor and bleeding problems. They do appear to be at higher risk of infant mortality as well. And their babies, once born, tend to be low birth weight. So, which can mean a lot of things. It may mean that your growth throughout life is always going to be less than what it should have been, low birth weight babies. The prematurity, again, if you're born too early, depending upon how early it is, there can be a variety of long-term consequences to that, although our neonatal care is so much better than it was decades ago. And then again, that extra support of being separated from a mother and in a special care nursery. So all those things are higher for women and their newborns who are at risk of homelessness, who are unstably housed, or who are already homeless. Identifying the women is, of course, much harder. You know, it's if you have become homeless, I think we even have problems identifying women who are pregnant on their intake to shelters. It's not necessarily a standard question that is asked. So sometimes people are not aware of the extra help and services that they should be getting because they are pregnant. The rest is all kind of social service, safety net stuff. And I don't have a good answer for that unless someone else here does.
I'll throw it open to anyone otherwise. I do have a follow-up question with what you were saying for either you or for Mary, and that is from the work that you're doing for women and children in particular who need shelter. Are they finding available slots in homeless shelters, or do you detect that the need at this moment is far outstripping the supply of available beds?
I think I can answer that. At this moment, there are openings in the shelters for families. There's that's the one slot that is open. I think the various payments that have come out from the government and now the temporary child tax credit have all helped, and the eviction moratorium have all helped keep families in place for now. So there are openings for families in shelters at this moment. Was there another part to that, Mitch? I'm sorry.
No, I think that answers it. And I have a question for Bob and for Sheila. With the tax credits and the incentives that we have as a state already approved, are there enough developers and builders out there who want to put up affordable housing?
Well, that's a complicated question. I think the challenge so far, based on, for example, the Illinois Housing Development Authority and the applications they get each year for the main program they have, which is the federal low-income housing tax credits, is they get many more applications than they're able to fund. So that part of that money from the federal fiscal recovery dollars that the state has allocated for those projects, $75 million, will help those tax credits go farther. In the omnibus legislation that we're expecting Governor Pritzker to sign soon, there's incentives for owners of properties that aren't using any other subsidized dollars from the Illinois Housing Development Authority or the City of Chicago Department of Housing to create and preserve affordable rental units. That incentive will just be open to any owner of a building with 7 or more units. So we're hoping more of those owners from the private market will be interested in providing affordable housing. But again, we really need the type of investment that Sheila was talking about from the infrastructure bill and doing things like making, rental assistance, housing choice vouchers eligible to every income eligible household to kind of create the really significant number of more resources to eliminate the severe shortage of affordable rental housing.
And I will point out, we have a comment here. Kids Above All has rapid rehousing for 10 young adults in Lake County, someone wrote. Also mentioned doulas who are working with pregnant women. And I'm assuming from the comment that the idea there is that they can be references for resources in the community as well. Let me throw this question out. We've talked about the currently available federal funding, the hope for additional federal funding to build affordable housing, the tax credits, and very often people say all of that is great, but the problem is local zoning. and allowing the type of units that would be affordable to be constructed. Any thoughts on that?
Well, I would say that one of the pieces that is really important along with that is the housing choice vouchers. And so I think Bob mentioned those previously, but housing choice vouchers subsidize the income, the housing income basically, of a family that in a way that allows them to operate in the private market. So I think that's something that we do want to be aware of, the importance of that, because that doesn't necessarily require the construction of more housing. That is a funding piece that can be used locally and impacts the local community and bringing funds to the local community and local landlords. So it's I think it's one of those solutions that we want to see. The issue is that there's not enough funding for that program, and there aren't enough vouchers and people are waiting for them for a very long time. So that said, I'd be happy to let Bob speak a bit to the zoning, more local zoning issues and things of that nature.
It is an obstacle, and it's a longstanding obstacle. There's many communities, particularly more affluent communities, that are often considered areas of higher opportunity in terms of employment availability or educational opportunity. And so again, in this omnibus bill, it makes some changes to a longstanding state law, the Affordable Housing Planning and Appeals Act, that encourages local governments that don't have much affordable housing to do more planning to do so. It is a limited state law, so it's going to have this changes, which I won't spend time going into the details. People can contact me if they want more information. It's a very positive change, but it's still a limited state law. It only impacts a relatively small number of local governments. At the federal level, one positive thing that's happened is that the Trump administration really did a lot of work to kind of undermine efforts that had happened during the Obama administration to get local governments to do more to affirmatively further fair housing and really follow not just the letter, but the spirit of the federal fair housing law that we've had for many decades now. And the Biden administration is working to undo the damage that the Trump administration did. So those Obama era affirmatively furthering fair housing requirements for local governments are coming back. There are going to be some changes, and again, it's going to be a long process to implement it, but that's another positive thing happening in this realm.
And there's also a federal recommendation to tie some infrastructure funding pieces to incentivizing areas that are in fact providing more affordable housing or shifting their zoning laws. So those haven't been passed, but they're in various pieces of legislation and recommendations at the federal level right now.
All right, we have another question in Q&A box. What states, if any, are doing better than Illinois regarding housing security and/or child health? And what can we learn from their policy and efforts to drive change in Illinois?
That's a very good question, and we've been trying to find that out as well. One thing that I can say is that we understand that Massachusetts has a right to shelter for families, and that's something that Illinois does not have. And then I'm going to throw it over to Nancy. We know that there are some programs in Washington State that they've been piloting for early intervention in terms of pregnant persons getting housing up front before they have their baby. And then some other programs, and Nancy specifically mentioned this one from Ohio. So Nancy, did you want to talk about that for a minute? But as far as we know, we don't have good models out there. Anybody who wants to let us know what they think are better models in other states, we'd love to hear about them.
We have actually specifically gone looking for speakers from states that are doing a better job, and it's hard to find them. I would say some of those programs in the state of Washington look as good as any we've seen, and we could send out a link to those studies maybe when we send out the program information.
That all sounds good. I do not see any other questions. Last call, either via the chat box or Q&A. So unless there are any, I'm going to thank our panelists for joining us today. We will in fact send out the slide deck, the video, a link to the video that is, and any additional information that we may have on the topics covered today. I want to thank everybody who joined us today to view this webinar. Again, you'll find in the slide deck all of our emails. So if you have any follow-up questions, please do not hesitate to email us and we'll do our best to answer your questions. So with that, again, I wish everybody a good day. Thank you for joining us and take care.